Hi, everyone. Sorry for the technical difficulties there, but thank you very much for joining. My name is Dr. Brian Harder. I'm a physical therapist here with Summit Physical Therapy. And before we get started, I just want to cover a little bit of housekeeping. One, if you have any questions or something that you want to get out of today, go ahead and drop that in the comments below. Drop us a comment below. Today is #GetPTFirst. Okay, some people have access to the images, some people don't. Some things that we're going to cover today. What is the problem of pain? Who are the musculoskeletal experts that can help you with the pain? What does physical therapy do? What is direct access? And then we're going to hit some of the harder-hitting, punchier questions that I tend to get often in the clinic. One phrase that I am accused of saying maybe a little bit too often is musculoskeletal problems require musculoskeletal solutions. So I want you guys thinking about that as we go through these different topics. Think about in the gym. How are you going to get jacked from one day of being in the gym? No. So this is my way of saying you have to listen to the rules of your body in order to get the results that you want. So keep that in mind as we move through this. Now, touching on the problem of pain, unfortunately, there are not many solutions when it comes to dealing with pain. You have 4 options. You have surgery, which should be the last line of defense and comes with risks. You have injections and drugs, which can mask problems, but again, it's not a musculoskeletal solution, so we don't have a permanent solution. We have the wait and see. This will get me riled up. This is not the option you want to choose, and I hope to make that point here in the next few slides. And then you have conservative management, the first line of defense. It's called conservative because it's not invasive, it's not surgery, it's not going into your body, that kind of thing. So what is conservative management? Physical therapy, and there's some other things that we could get into on another topic, Eastern traditions, that kind of thing, beyond the scope for today. So what does a physical therapist do? I would just like to sum it up and say we're the first line of defense for the general practitioner when you have a musculoskeletal problem, which is most pain. So chances are you have pain, call up your PT. If you need more than that first line of defense, then we can route you to the next appropriate place, be it an orthopedic physician, be it another healthcare provider. But if there is a musculoskeletal problem, weakness, pain, a functional task that you're having trouble doing, that's what we do. One thing I want you guys to be looking at is the worksheet. Make sure I'm answering your questions. If I'm not, please drop it in the comments below. And again, do we have any questions so far? We're good on questions right now? Okay. Moving along. Direct access. What is it? Direct access just means literally that. You can come directly to me here at Summit East Brainerd. There is no physician referral required. You can just call and get on the schedule. All 50 states have some form of direct access. Tennessee, which I'm really appreciative of, they've done a great job with this. They have 90 calendar days of physical therapy direct access, no physician required. Other states, not so good. Alabama, one of them, you can only see a PT for 1 session before you require a physician referral. So you can skip the line, go directly to your healthcare provider of choice for musculoskeletal problems. Now, the hard-hitting questions that I tend to get on maybe not a daily, but definitely a weekly basis. Shouldn't I see my physician first? How can you know what to do, Brian, if you don't see my x-ray, if you don't see my MRI, you don't see my CT? What is the cost? Isn't physical therapy expensive? Why does my insurance want me to go to PT before getting an MRI? These are all questions that I have to field on a daily basis. And before answering them one at a time, I'm hoping to answer each one of them as we go throughout the slide, but I invite you to really ask me those questions if you don't feel like they're answered well enough for your liking. This study here tracked knowledge levels across the healthcare spectrum. So all relevant healthcare providers. For those of you that can't see this image, the top 2 musculoskeletal experts, according to this one study, was orthopedic physicians and specialty physical therapists. And then coming behind that would be physical therapists without a specialty. So this is the study that essentially proved if you have a musculoskeletal problem, go see your PT first. If you have something that requires surgery, then we're going to go to our friends over at the orthopedic physicians. Now, I'll just take a little bit of a minute to say too, if it's not a musculoskeletal problem, don't come see me. We're not here to claim that we treat all the things in the world. If you have the flu, don't come see me. But even if you don't know, if you have some pain, we are trained to get you taken care of, going to the place that you need. So whether it is physical therapy management, we got you here at Summit. If you need surgery, we have friends in town that we refer to often, or maybe you need something more in-depth, endocrinology, neurology, anything like that. So it's all about the healthcare team and getting you where you need to go. I want to back up really quickly, go back to a few of the most common treatments that we do in PT to listen to the musculoskeletal needs of the body. Manual therapy, dry needling, different therapeutic exercises. Going to be some combination of hands-on skills with movement-based therapy graded at what you need based on the goals that you have. So it's not all hands-on, it's not all exercise, should be a combination of both. Okay, I tend to talk pretty fast, so let me pause for one moment and see if we have any questions or if we have any comments from before about what they want me to cover or anything like that. About 30 seconds or a minute or so there. Question is, does physical therapy help with chronic pain management? I'm going to talk about this a little bit in some upcoming slides, so I'll save it a little bit. But short answer, yes. I've actually literally done an entire 45-minute presentation on how pain works and what to do about it from a clinical perspective. It's a highly involved process that takes a lot from the patient themselves. So we can help, but it's often a multidisciplinary and highly involved situation. All right, good question. Study here, again, some people can't see all my slides. This was the study that launched physical therapy into the ability to have direct access. There's 2 approaches. There's the old or traditional approach, let's say, where the average cost was $2,100 to $2,200, and that's where what you think of when you have a medical need. You go to family practice, then you might get referred to imaging, then you might get referred to a specialist, and then hopefully you get referred to a physical therapist if that's appropriate. So there's traditional method. New approach, which is about $1,000 cheaper in this specific study, go directly to your physical therapist. Go directly to your first line of defense for your musculoskeletal needs. Again, this saved about $1,000 for these individuals in this specific study. In some other studies that I'm going to have coming up here too, decrease delay, increase outcomes, and if there is a need for you to be referred, I'm going to show you some stuff coming up that just shows that we know where to get you if you need to go that route. A little more on cost. Think about if you choose the wait and see option. So this is when I said that we're going to be going with the wait and see approach. You're almost definitely looking at a more expensive situation in the future, whether it is physical therapy that will require longer duration, more visits per week. Like, it's just going to be a more expensive case if you've been dealing with the condition for longer. Literally spoke with a gentleman today, jaw pain since before I was born. I told him straight up, like, this is going to be months, not weeks. So please get to me in those earlier phases, not before I was born. If you don't pursue treatment, you're having to live with the pain or limitation that is likely, particularly after 6 weeks, likely to worsen, not likely to stay the same. The musculoskeletal system tends to adapt to its environment, whether it's sitting on the couch or whether it's training for marathons. And pain tends to lead us towards the sitting on the couch. If we wait too long, sometimes we can get into a place where it was treatable by physical therapy, and then it's not treatable by physical therapy. So then we're risking the more invasive. We have to go to the surgical route of things. And then uncommon, but possible, we're missing something more serious: fractures, cancers, infections, this kind of thing. Question, where can I do my home exercises? I think that's also listed on the worksheet. Here in the clinic with me, out in the community doing yoga with our favorite yoga instructors, in the gym or at home. I really, really try with all my people. If there's something more complicated, I'll ask first. Do you have access to this piece of equipment? Do we need to get you some TheraBands? Do you have access to weights? So whatever it is, the location shouldn't be your limiting factor. Thanks for the question. Do I need a referral from the physician? So this is what we were getting at with direct access. In Tennessee, which I'm assuming a lot of my listeners are going to be from Tennessee because Summit is located only in Tennessee currently. We have 90 days, 90 calendar days without a physician required for me to see you. The caveat then becomes certain insurances. Most insurances will cover it. Some insurances only cover the first visit. Some require something called pre-authorization, which essentially means they won't pay for direct access care. At Summit here, we will check all that for you. So I would encourage you to just give us a call and we'll tell you if your insurance covers direct access or not. Yeah, that answered that question. Okay. Now, looking a little bit more through the facts, and the whole point of these next few topics is just to say, hey, this isn't Brian's opinion because he's a physical therapist, so he must like physical therapy. I wanted to give you a little bit of evidence base behind my somewhat strong opinions. I have 2 points to make on imaging here. The first one, and this is answering the question, don't you need to see my image first? I have a study here, disc herniations. We've all heard of somebody with disc injuries. I got a disc bulge, I got a disc protrusion, or whatever, what have you. This study showed the worse the injury, the higher the rate of spontaneous regression. Fancy word, just means the disc healed. Discs heal just like the rest of our bodies heal. I want to really reinforce that point. We are biologic organisms, we're not cars. I don't like it when people compare me to a mechanic for people. We've all heard of wear and tear arthritis. Wear and tear works normally for a car. The more you drive the car, the more the car is used and worn out. Actually, the opposite is true in humans, in most biological organisms. less use results in more of this quote unquote wear and tear arthritis. So we've got to find that sweet spot there. And again, if we're thinking about humans as cars, you are not going to the right healthcare providers. So we are robust, adaptable, and can change and heal. Okay, next one is probably my most science-y slide. This is for my more medically minded folks. Maybe some of you here are in the medical persuasion, so I wanted to bring this up for the people that really wanted to dive deep with me. Two major points. One, I have a list of red flags here. What is a red flag? It means the scary stuff. It means the stuff I can't help with. It's the stuff that I'm going to be referring you out for and have referred out for. There's a list here if you want to see them. But the whole point here, we go through a doctoral level of education to be able to understand what can we help and what can we not help. Red flags being one of those things I'm not going to be helping you with. Point two, and this is one of those things, again, Brian didn't say it, the experts said it. The American College of Radiology, which is the literal experts on imaging, so imaging is x-rays, MRIs, CTs, whatever the image is, these guys are the x-ray on it, or are the experts on it. This is the first slide from them, and you can pull up their website and find this slide here. For acute, meaning short-term low back pain without prior management, they literally have no scenario in which an x-ray, an MRI, or a CT is recommended in the absence of red flags. So that's from the physicians themselves that specialize in imaging, not just Brian getting on a high horse against images. Take-home message between these two rather clinical slides. If you have pain that changes with movement, chances are I can help. Okay, diving a little bit more into some of the evidence. This one comes from the University of California, that when you go to physical therapy first, fewer visits required, and actually greater outcomes come from that as well. So fewer visits, more improvements than having to get through the whole system, because it delays care when you have to go through that whole traditional cycle that we talked about. No, this study for new onset low back pain, and this is thinking short term, in the first 90 days, 32% lower costs for those individuals. Okay, that's just in the first 90 days. This study also tracked 1 year outcomes. Those people saved an average of $4,000 over a 1 year period. So if we're thinking about cost, again, I'm just trying to drive home the point that, yes, chances are physical therapy costs money for most people, but if we get it done now, costs are lower in the long term rather than waiting and seeing or going through the healthcare system to get here. Now, is it safe? This also goes back to my slide on red flags. This was a really interesting study, 2015 in the university setting. Almost 3,000 encounters with direct access to physical therapy, 0 adverse events, not one. 0 problems occurred with those 13,000 cases. Okay, so again, why were there not problems? Because we're trained to screen out for non-musculoskeletal conditions, and we help the musculoskeletal conditions that walk in. Now, this one was for patellofemoral pain, for knee pain. When people saw a physical therapist first, they saved about $1,000 with as long as they saw PT within the first 30 days of that occurrence. Okay, now if there was a study, you could maybe accuse me of being nerdy here, but if there was a study that I would have to say is my favorite study of all time, it is this one here. This one imaged over 3,000 asymptomatic patients, so no pain whatsoever. They just wanted to see What do spines look like in people that don't have pain? Because most of the time when people get an image, it's for a reason. That makes sense, right? So they said, hey, what does it look like when patients don't have pain or aren't coming in for some sort of problem that needs solving? They found something on nearly everybody. 50% of 50-year-olds have some sort of disc issue. And like we talked about before, discs heal, and we should solve those conservatively, even when they are pain generators. But again, asymptomatic, they found things in just about every case. So just because we find something on an image doesn't mean we jump directly to surgery. You applied for a question. How much can you say? Yeah, how much can you say? I mean, oh man, depends on which study you look at for one, also depends on what problem you're dealing with. It also depends on, I hate to say it, but it also depends on what your insurance benefits are. So the cost of arriving to PT varies pretty widely between people. So it's tough to say from the specific person's questions how much money that specific person will save. But again, go back to what are you not having to go through because you're paying for physical therapy first. You're not having to pay co-pays for family care. You're not having to pay for MRIs, which are notoriously expensive and tend to cost 8 to 12 visits of seeing me just for the image, which is only diagnostic and not therapeutic. You're not receiving injections, which again are symptom maskers, not symptom solvers, and you're not getting drugs, and we can get into the whole opioid thing another day. Hopefully that covers that one. Any other questions while I'm transitioning? Okay. So covered. Oh, we do have a question coming in. What question? Bring them in. Give me all the questions. I've covered the meat and potatoes of what we're covering, so send them my way. Are walk-in screens available? Yes. We can cover walk-in screens. Chances are we're going to need to walk in, get it on the schedule, and then run all the various things that have to do with your insurance. Does it cover direct access? This kind of thing. So the answer is actually maybe, depends, but I can at least take a look and tell you if physical therapy is going to be a pursuable option for you or not. Okay, well, speaking of free screens, what a good segue. I have blocked out 6 available free screens for next week. There's a reason you guys are here, right? Unless some of you, I know are my patients. Good to see you. Thanks for coming. Thanks for the support. But for those of you that are not my patients supporting me, there's a reason you're here. Either you or a family member is having a problem, probably been dealing with something for long enough to where it's not been solved by this traditional approach. Let's try the new approach. Let's get this person seen. Let's get you seen by someone that is an expert in musculoskeletal wellness. So I have 6 free screens available. I need you to drop a DM in Facebook or Instagram, wherever you're here. Say free screen to get your spot. Got to get that within those first 6 people that do it. So again, that one's free. So talking about cost savings, come see me. I'm at the East Brainerd location. And this is just to say thank you for attending me talk about one of my favorite topics in the world, and that's access to conservative care and solving the pain crisis in America. Got a few locations for you. I'm at the East Brainerd location, so I'm a little biased in which one I think you should go to, but we do have some wonderful colleagues at Red Bank, Dixon, Saudi, Ottawa, Cleveland, and coming soon, North Shore. And if you want a free t-shirt, submit your completed worksheet to bdrepresentative@summit-therapy.com. Free t-shirt. Everyone love free swag. Okay, so there is everything that I had to say. If we want me to recover anything or get into something in a little bit more detail, or just have a question that you want to ask your friendly neighborhood physical therapist, shoot away. We'll stay live here for a little bit longer and wait for questions to come in. While we're waiting for questions to come in, oh man, I could tell so many stories about, and this is what prompted me to want to do this free workshop in the first place. I see it so often, so it's tough to even decide which story to give you. Saw a guy not too long ago. He was in a car wreck literally 3 years ago and has been having neck pain since then. And so from a clinical perspective, if it's been going on for 3 years, it's not going to be one of these catastrophic red flag things. So that alone tells me it's probably solvable by physical therapy. He had a job that required a frequent change of his head position, lots of use of his arms. Now he's back to doing everything he wanted to do, but he was in this loop, only getting these Band-Aid fixes for 3 years when he could, if he would have known about this direct access capability, he said, "Hey Brian, I was in a car wreck, can I come see you?" And then we could have shortened 3 years into a few weeks. So that's my whole goal here is to prevent as many cases like that as we can, because it's so unnecessary. What is my favorite diagnosis to treat? Oh boy. Man, I've been flying high on jaw pain recently. One, because so few people know that we treat the jaw, but what is the jaw but a musculoskeletal joint, just like every other joint? So why wouldn't we treat it? Would be what I have to say to that. But I've been really on a mission to educate Chattanooga about what we can do with jaw pain, and I've just been having nothing but success with it. So that's been really fun recently. And then I would say I also really like cervical radiculopathies. Big fancy word. Neck pain with pain down your arm. If you're having pain down your arm and you're noticing that your neck doesn't maybe move as well, please come see me. I mean, that's a classic condition that is one of my favorites to treat. Another question that I have to answer on a daily basis. The difference between dry needling and acupuncture. I am certified in dry needling. Yeah, it was different to get into at first, but I'm really glad that I got the certification, because I've seen marvelous results from it when used for the right person at the right time. In some, they are the same needles. I mean, we often buy them from the same suppliers. The thing is, the philosophies are different, the techniques are different. Not 100% true, but oftentimes in the acupuncture world, they go to a shallower degree, skin level, fat layer, whereas dry needling, we're getting directly into the muscle belly to stimulate more of that musculoskeletal response and get a response from the muscle level. Some difference in in physical therapy, we tend to not deal in cheese and chakras and flows and this type of thing that they tend to more in the Eastern traditions, which there's a lot of dry needling research that it just comes from acupuncture research, if we're being honest. It's just different approaches and often different depths. That's a quick answer to that. Okay, more questions coming in. While I'm waiting on those questions, one thing that I tell my friends and family when we're discussing PT is like, look, let's be honest about what PT is. Like, there's some work involved, guys. I mean, I can tell you about the costs. I can tell you about like what you're not getting if you don't do it. But at the end of the day, there is some work involved. So, when I tell my mom, when I tell my brother, hey, like, you need PT, and they're like, what's it going to be like? What's going to be involved besides the cost and this and that? I'm just like, it involves movement. So sometimes that can be one of the biggest obstacles. But the best case scenario for me, if you're not introduced to movement, if you're not introduced to exercise, that's okay. Like, I work with those people all the time, and there's nothing I love to see more than people starting their movement journey with me, and then they go off into the gym, and then they come back a year later, and they're like, oh, I started here, and now look at me. So don't let the discomfort or fear of movement interfere with you getting the physical therapy you need, whether it's me or whether it's somebody else. Okay, question. If we don't have a free screen, how do we schedule an appointment? We have a referrals line, so should be, if you just Google Summit Physical Therapy in Chattanooga, we have, let's see who's on the board here. Call us, that number there. If you can't see it for whatever reason, Google should have it there listed too. Call that number. We have a referrals line. They'll ask you which clinic you want to go to. Tell them you want to see Brian, unless you want to go over to a different clinic. That should be fine. And again, we'll run all of that, the cost stuff, and does it cover direct access and all of this. We can take a look at all that for you. All right, I loved the questions. I would do another half hour of questions if people aren't ready for me. I love questions more than giving a presentation sometimes. But that's all the fun we have time for today. Thank you so much for coming. Please give me a call if you have any questions, concerns. I am here to help.